The Orlando mass killer was clearly emotionally unstable. His ex-wife has reported that he was erratic, violent, and often irrational. He was also legally armed with an assault rifle and a 9mm handgun. The U.S. Surgeon General says that gun violence is a public health threat that needs to be fully understood in order to deal with it effectively. Dr. Murthy, thank you so much for joining us.
Of course, I'm so glad to be here, Fernando.
So, gun violence, obviously very much front and center in the nation's consciousness, something that has plagued the country, some 30,000 or more gun deaths every year. What do we know about it? What's the information that we have available to us to understand why this country in particular has such a high level of violence?
Well, what we know is that gun violence is devastating families and communities all across America. As a physician, I've cared for many patients who have been the victims of gun violence, and I've seen just how damaging it can be, not just in the moment, but also for years afterward, as people suffer with the trauma, both physical trauma and mental trauma, that comes with gun violence. So this is a terrible problem, but the truth is we don't know enough about gun violence and how to solve it. And part of the reason we don't know enough is that as a country, we significantly underinvest in research when it comes to looking at ways to tackle gun violence.
But that's on purpose, right? There's actually a ban on the CDC from Congress to prevent them from researching gun violence. Is that correct?
Well, what we see is that if you look at cancer and diabetes and cardiovascular disease, we care deeply about reducing deaths from those illnesses. And so we invest in research to understand what causes them, what treatments might work in reducing the number of folks with those illnesses and the number of deaths related to them. But we don't do the same thing when it comes to gun violence. But most importantly, and something that we don't think about very often, is that we have to address emotional well-being in our country. We have to ask ourselves the question, what causes people to have so much anger? And when we look at that, what we realize is that we have a great degree of isolation and frustration among many folks in our country. I used to say often that when I was seeing patients up in Boston, that the most common illness I saw was not heart disease or diabetes, but it was isolation, it was social disconnection. And we have to address that. When we look around the country, what we see is that there are in fact programs which are working on improving emotional well-being, and those are having a dramatic impact on reducing violence. So part of my goal as Surgeon General is to understand what the scientifically driven tools are that can help us improve emotional well-being so that we can not only decrease violence, but so we can also improve health, improve educational performance and workplace performance as well.
Dr. Murthy, thank you so much for joining me today. The nation's largest group of doctors, the American Medical Association, voted to call gun violence a public health crisis at its annual meeting this past week. The AMA will now push Congress to overturn legislation preventing the CDC from conducting gun violence research.